Okay, we can get started on webinar 12 for the post-active treatment surveillance in prostate cancer for the NCDB special study. So the purpose of this study is for patients who have received curative intent prostate cancer treatment to determine whether more frequent PSA testing leads to better survival or more harm for the patient. So in order to answer this question, it is important to know every PSA test that the patient had, and also to know exactly how frequently a patient is having PSA tests. And we also want to know if the patient has had a recurrence. So our goal was to have each site complete 12 patients for the special study. So monitoring for the study so far has shown a higher than expected rate of ineligible patients. So our sample size seems to be much lower than what we initially projected. So only patients who are treated with either radical prostatectomy or radiation for prostate cancer are included in the study. Since we've had these lower than expected numbers, we made changes to the eligibility criteria, and these study modifications were necessary to reach the projected sample size. So for patient eligibility question number 1, the requirement for medical records will decrease from 5 years to 3 years in the first patient-level eligibility criteria question for, is there evidence that medical records are available for this patient for 5 years or until a distant recurrence or death, whichever is first. So the replacement patient queue will include patients diagnosed in the years 2008 to 2010. Previously, only the patients diagnosed between 2005 and 2008 were included in the study. And so we just want to stress that you can still have patients on your list from 2005 to 2007. So your original list would not change, only the replacement queue would contain patients from 2008 to 2010. And we would ask that you determine your patients from 2005 to 2007 are eligible first before marking them ineligible. Even if you are able to get the 3 years from the 2005 to 2008 patients, then we would like them included in the study first before you mark them ineligible. So these changes went into effect on Tuesday, May 30th at 11:59 p.m. We also updated the instructions version 2 on the website and the web form, and the updated instructions will not be mailed out. They'll only be available electronically. So the new deadline is August 28th, 2017. Sites that have completed the study prior to May 30th will not be affected, and the 2008-2010 patients will only affect the replacement queue when a patient is submitted as ineligible. So previously submitted cases will still count towards the 12 total. Additional cases have already been added if the site has less than 12 patients, but sites are not required to submit more than 12 patients. So thanks for asking the questions. They really help make the webinars worthwhile for attending. So many questions relate to, is the patient eligible? So PCPs may have checked PSA's biopsy scan. It would be important to enter all this information if the PCP checked these items that are relevant to the study. So it is recommended that you wait 2 weeks once the template letter is sent and the office is called multiple times to hear back from an outside facility before marking a patient ineligible. So the key question is, do you feel you are able to record all the PSAs a patient has had after treatment? 3 years is required for a patient to be eligible, and once eligible, we ask that you enter all of the available data and stop at 8 years. So for the eligibility criteria, there's 3 questions which all have to be answered yes. So the first one is evidence that medical records are available for the patient for 3 consecutive years or until distant recurrence or death, whichever is first. And then also the second one is for patients who receive primary radical prostatectomy, the patient's urologist and primary care physician can be identified. And for patients who receive primary radiotherapy, the patient's radiation oncologist and urologist and primary care physician can be identified. And then the third one is the patient has at least one PSA test result within 2 years after the end of primary treatment, and the registrar is confident in capturing the PSA information for 2 years after the primary treatment completion. So if any of the eligibility questions are answered no and is submitted, a new patient should automatically be added to the list once the page is refreshed. So please wait at least 2 weeks to hear back from outside offices for records, and please mark the patient ineligible if the outside office does not respond after multiple requests. If the patient does not have a PCP, then the patient is eligible, but if you do not know if the patient has a PCP or if the patient has a PCP but you are not able to get the records, then this patient is not eligible. So a complete record for 3 years is needed for patients to be eligible. However, it is possible that some patients did not have PSAs done every year, and that's fine. They could still be eligible, but you just need to have the records that show that the PSAs weren't done that year. Only the questions on the web form are the required information for the study, and patients receiving care at the VA, so Veterans Affairs, or the DOD for prostate cancer or prostate cancer follow-up are not eligible. So please enter PSAs until the time of distant recurrence or death or until the end of the surveillance period, not at biochemical recurrence. Please round the results to the nearest tenth, and then registrar should follow the Ford's manual. So for example, a PSA of 1.2, the registrar can enter 0.12 or 1.2. So numerically, these are identical numbers and will not affect the study or data analysis. Except when a patient has a result of less than 0.03 or less than 0.01 or less than 0.2 or less than some small number, please enter the result as 0 for the special study. And this is one of the only instances where we differ from the Ford's manual, and the example was given in the instructions to specifically show this. So for the NPI information, urologists, radiation oncologists, and the PCP NPIs can all be on the same line on the surveillance tab. Some people are getting errors in submission because people are using these as blanks and they'll do a new physician per line. So if you can put them all on the same line and then no blanks should be entered on the screen. So when the doctor indicates possible recurrence and a treatment starts, this should be considered recurrence. The date of the recurrence should be the date of the doctor's note, and the term salvage radiotherapy indicates the recurrence. So after definitive radiation treatment, if cancer is shown in the TUR pathology, please record as a local recurrence. So for the special study instructions versus the Ford's manual, there are some differences. So all the instructions in the special study instructions document are for the special study only. Ford should be used for routine data collection for the NCDB, and specifically the instructions for coding biochemical recurrence and patients who are never disease-free instructions differ from the Ford's definitions and are only for the special study. Do not update the NCDB with recurrence differences, and we realize this is different from Ford's. If you find that a patient has had a recurrence by Ford's definitions and that recurrence was not previously recorded in the NCDB, please update the patient's NCDB record with that information. So if error messages appear when using the data links credentials when logging into the web form, please use the lowercase if there is a capital in the password. Once a case is submitted as ineligible, it will automatically be replaced and will not appear on the patient list. The web form will not allow for submission of incomplete information. So we ask that you please make sure that if you're having errors when submitting a patient to Make sure that the confidence questions on the bottom of the PSA and the scan tab are answered, and also that there's no blanks on the surveillance tab. If changes need to be made to a submitted patient, please email specialstudy@facs.org, and please include the special study IDs and FINs in your communication. So this is the slide on study communication. We'll post all study announcements, instructions, updates, and all the webinars and previous webinars and the PowerPoint slides on the Special Studies website and also on the Cancer Forum and Standards Resource Library. Please send all study-related questions to specialstudy@facs.org, and if you are sending them to personal fax accounts, they will be forwarded to the special study address. And you can also access this email through the web form on the contact form on the web form, or email specialstudy@facs.org. So please don't send both, as both emails go into the same account, and include your FIN in all communication. And if you're talking about a specific patient, please include the special study ID. So emails for the special study are being sent from specialstudy@facs.org email address through an outside server. If you've not been receiving these emails, send the following information to your IT department and ask them to put us on the whitelist. So if you are still having issues with this, please just work with your IT department. Here is the slide with all of the webinars we've had so far and the NCRA National Program Recognition information. So today's is the first webinar worth 0.5 CEs because it's only going to be 30 minutes, and the rest of the webinars from now on will also be worth 0.5 credit hours and only 30 minutes long. We will be canceling the webinar on July 4th and July 11th, but we will resume the following Tuesday, and we will go up until August 22nd. So the updated instructions document version 2 is available on the study website and the Cancer Forum. So questions from previous webinars and the Cancer Forum will be included on all webinars. If the site is complete with the study, attending the webinars is no longer necessary unless they need the NCRA credit. So now we will be reviewing the frequently asked questions from the previous webinars. So for recurrence, what PSA level should be used to classify a patient as having a recurrence? We are not asking the registrars to interpret the PSA results, so please record recurrence if the clinical notes indicate a recurrence and/or if a patient receives treatment for recurrence. So if only for the special study only, if the patient has a recurrence, if he was never disease-free, the answer is yes. So please record the date of the first PSA test after primary treatment as the date of recurrence. So the doctor's note may say persistent disease after treatment, and that is also known as never disease-free. So for standard 5.7, are sites automatically compliant with the standard for submitted cases to the study? So yes, once sites that submit all their patients by the study deadline of August 28, 2017 are compliant with standard 5.7 in 2017. So what if the urologist and the PCP are retired? So we still would like you to try and find the records. So please see if it's possible to collect the records from their offices. Often the physicians may have retired, but the records are still available. All MPIs are required for each provider that saw the patient during the surveillance period. These will not automatically populate like the NCDB tab. And if the NPI on the surveillance tab is unknown, we ask that you enter zeros for if there's no provider, 9 for if they have the provider but the NPI is completely unknown, and 7s if it's unknown whether they have this provider. And this coding is similar throughout the instructions document. So comparing what information the NCDB tab has for a patient to what the medical record contains, there is always more information available in the medical record than what was initially abstracted. So, for example, the Gleasons on prostatectomy and the date of last contact weren't fields that were collected at the time of diagnosis. So we are asking that you re-abstract those as current information. So please select no and fill in the updated information. We are looking for the most current data, and we're asking that you use the Ford's 2016 manual. So if the NCDB fields are blank, please enter the correct information. Some fields were not collected until 2010, and the available values for Gleason patterns are 1 through 5 and 9 for unknown, which is different from Ford's. And the web form will not allow for blank answers. So for the pathologic T and pathologic N, if the answer should be changed to a blank, please enter 88 for the special study only. And if it was already a blank, then you do not need to update it to 88, only if you need to change the information. Okay, and so then we can go back to the slide on study communication, and then we will start answering the questions from today's webinar. So if a patient meets all of the eligibility criteria, but there are less than 8 years of total records available, does that make the patient ineligible? So a patient is eligible with 3 years of records. The 8 years is a stopping point. It's not the eligibility criteria. So you would need so if the urology office has consecutive 3 years of PSA done every 6 months post-surgery or radiation therapy, if the PCP does not respond, can you submit since the urologist did the initial follow-up? For this study, we need the PCP records to be eligible because the PCP might have checked additional PSAs, which is the only way to know if, if, if you can get the PCP record. So the only exception is if the PCP office is able to confirm that no PSA was checked by the PCP at all. So we want to be sure that the PCP, if you only have the urologist records, you want to be sure that that you can be sure that the PCP didn't check any additional PSAs also. So the study needs to know the total number of PSAs checked for the patient from any provider. So if the PCP does not provide records, then the patient is not eligible. Then this is unfortunate, but incomplete information about the total number of PSAs checked will make the data analysis wrong. One of the primary goals of the study is to see if patients with more PSAs live longer, so knowing all of the PSAs from the different doctors is very important. So we're asking that you please make sure that you're counting the 2 years based on the surveillance period, which is defined in the manual. So it is unusual for a patient to not have any PSAs checked during the first 2 years of surveillance. It might indicate that records are incomplete or a patient was lost to follow-up. But unfortunately, if the patient had no PSA test result within the first 2 years of surveillance, then the patient is not eligible. If your reference year is 2011, your facility would be exempt. So if you mark a patient ineligible, then you're not getting any more patients to review. Will this affect accreditation and meeting the standard? So right now, our primary concern is only accepting eligible patients. So that is fine if you um, have less than 12 patients that are eligible. We just want the eligible patients, and you will still receive credit for meeting the standard if you complete all your patients by the deadline. So I think we have 5 more minutes to answer questions. And here's the slide with all of the CE information. So if you have the actual result of the PSA test, please enter the result. So if the result says less than zero point 0.2 or less than zero point 0.1, then please enter 0. But if you have like 0.13 or 0.17, you should enter that number. So if you have patients who might be getting their PSA requested by the urology but have the PCP at the same facility, that does not matter and that's fine. If it's fine if you're using the urologist as the requested physician since the PCP is within the same clinic. So if you have 3 cases left, please see if they are eligible, and if some or all of the cases are not eligible, then you should be getting replacement cases. So if it's before your reference year of the 3 cases, then please see if they're eligible, and if they are, you can submit them, and then if not, you can mark ineligible and get replacements. So I think that's all the time we have for today. If you have further questions, please email specialstudy@fax.org, and we will see you next time.